Miss Ugochi Onwachukwayu. I've got an appointment with the nurse this morning.
Yes, I can see you. Okay, please take a seat. Jerry will be with you as soon as he's finished.
I'm Ugochi, and quite recently, I found out I've got cancer. I mean, what a shock. It still doesn't feel real, if I'm honest. I'm going to have chemotherapy as part of my treatment. I'm going to have it by mouth, or as the hospital calls it, orally, which means it'll be a tablet or capsule that I'll swallow. Chemotherapy. What a terrifying word. I've got a million questions. My mind is in overdrive and my heart is racing in my chest. But surely taking it by mouth will be okay. After all, I already take tablet medication for other things.
I'm Joe, one of the nurses. I know Ugochi's anxious. Who wouldn't be? Chemotherapy is such a big unknown, but I'm going to do my very best to answer all Ugochi's questions and, of course, help put her mind at ease. Ugochi, I know you have lots of questions to ask me, but is it okay if we perhaps first take a step back and talk through some of the basics?
Yes. Okay, back to basics. I suppose the basics are the best place to start.
So let me start by saying that chemotherapy is just a word that means medications, or drugs as we tend to say. Our bodies are made up of cells, like tiny building blocks, that replace themselves as they wear out. Cancer happens when a single cell starts to malfunction and keeps copying itself in an uncontrolled way. It might help to think about chemotherapy as a range of medications that try to destroy the cancer cells. In this way, they can stop the cancer from spreading or reduce the chances of cancer coming back. Although chemotherapy medications are most damaging to the cancer cells, they still have effects on other normal cells. This is why you may experience side effects from treatment. Chemotherapy may be given as a single medication, but is very often given as a combination. It can either be given by itself, or it may be given before or after an operation. You might also have it alongside another treatment, such as radiotherapy, immunotherapy, or a targeted treatment, which is a type of drug that acts on the specific type of cancer that you've got. Is that okay so far, Ugochi? All making sense?
Yes, I'm following you. But you've got me a bit worried now. Like I'm going to get piled on by doctors.
Oh no, it's not like that at all. I just wanted to let you know what all the possibilities are. As your chemotherapy treatment is by mouth, you'll collect the medication directly from the hospital pharmacy and then take it at home. We'll give you precise instructions about this though. The guidance varies for different types of chemotherapy medicines, so we'll explain exactly what you'll need to do. For example, you might need to take more than one strength of medicine, and you might have to take it more than once a day.
Oh, okay.
Let me tell you about the steps all patients follow through treatment, or the pathway as we call it. Before you can collect each supply or cycle of tablets, you'll need to have a blood test and also an appointment with one of the clinical team. This might be in person in clinic or by telephone or video. The clinician will ask about any side effects you've had, and they'll check that your blood tests show that you're fit to take the next supply of tablets. We refer to this as a cycle of tablets. The clinician may make some changes to your chemotherapy dose to help lessen any side effects that have been bothering you. Once your blood results have been reviewed, a prescription for your chemotherapy medication will be checked and authorised by a cancer pharmacist. The pharmacy within the hospital will prepare it for you. Oral chemotherapy medicines are different from other kinds of medicines, so you can't collect them from a high street pharmacy like you might do for other ones.
Oh, so will I do all of this on one day?
You can do, but the blood test sample can take a few hours to process, and pharmacy can only give you the medication once the results are reviewed, so it can end up being a very long day waiting around. An alternative would be to have your blood tests up to 2 days before the appointment, so the results will already be available for the clinician to check. If your appointment is not face-to-face, the prescription will be sent directly to the hospital pharmacy, and you'll be advised to go there directly to collect the medication. Before you start your chemotherapy tablets or capsules, we'll give you a treatment record book and we'll write all your appointment dates in it, like a diary. The book also has your treatment details in it. Oh, and there's space for you to write down any side effects or questions you may want to ask the doctor or nurse. You can also use this book or another notebook or a reminder app to track whether you've taken your chemotherapy medicines each time, to help make sure you don't miss a dose or accidentally double up on one.
That's a good idea. Everything in one place. So you mentioned side effects. That's the biggest problem, isn't it?
Okay, well, look, there's certainly the most to talk about here, so let's discuss those now. Like I said before, chemotherapy medications aim to cause most damage to cancer cells, but they still have effects on the rest of your body, and this may cause some of the side effects we're going to discuss now. Oral chemotherapy can cause side effects like intravenous therapy can. It's not a gentler way of giving it, it's just different. But the key thing to remember, Yugochi, is that everybody's experience really is different, and you may experience very few side effects. Some patients may have no side effects at all.
You can't do anything to stop them.
We're able to prevent or reduce many side effects as long as you tell us that you have them. So please be totally open and honest about how you're feeling when we ask you.
Okay, so that's why that treatment record book is useful.
Yeah, correct. The biggest concern for us as the team looking after you is the risk of infection. Chemotherapy also has effects on your blood, especially a component of your blood called white blood cells. Now, they're the bits in your blood that fight infection. Chemotherapy makes white blood cell numbers go down, so your natural resistance to infection is reduced. And this is really important. If you get a high temperature above 37.5 degrees, or fevers, shivers, shakes, or just generally feel unwell, you must call the helpline. And if it's over 38 degrees, then you should come straight to the accident and emergency department. Do not delay.
Okay, but what helpline do you mean?
When you first start treatment, we'll give you an alert card which has the acute oncology helpline phone number on it. There's somebody available to help 24 hours per day, 7 days per week. But if the line is busy, please do keep trying. The nurse who answers the phone will tell you whether you need to attend the hospital, either to clinic or to go to A&E, and give other advice. You may be advised not to take any further oral chemotherapy until you have been reviewed by the team. This helpline number isn't for general questions though, it's just for if you feel really unwell. But if you develop severe chest pain or difficulty breathing or severe bleeding, then you should dial 999.
I understand. That sounds scary, actually, having to call 999.
Oh, I'm sorry, Yugochi. I know this is an awful lot. I have to prepare you, though, for what could happen. But that doesn't mean it will happen. Look, a lot of what I'm saying is not common, but you do need to know about it.
Okay, yes, I see.
Is it okay if I tell you about some of the other side effects that can happen with chemotherapy?
I'm listening.
A lot of people are anxious about being sick whilst receiving chemotherapy.
I was going to ask about that.
Nausea, that's feeling sick, and vomiting, that's being sick, used to be a big problem with chemotherapy, but it's really not such a problem anymore. And that comes down to how well the anti-sickness medications work and how we use them. We may give you anti-sickness medication to take alongside your chemotherapy medicines, or we might give you some to keep at home so that they're right there in case you need them. Although some of the treatments don't usually cause this side effect at all, so you may not be given any anti-sickness medication. It really depends on exactly what chemotherapy tablets or capsules you'll be having. Some tips to help manage nausea include eat little and often. Let other people prepare food for you if possible. Oh, and do ensure that you drink plenty. It's really, really important that you don't become dehydrated. If you do actually vomit, you should call the helpline we discussed just now. If you vomit after taking your chemotherapy medicine, don't take more of them. You shouldn't take another dose until the next scheduled time. Even if you think you vomited up whole tablets or capsules, you may still have absorbed some of the chemotherapy. That's why you need to wait until the next dose is due.
That's reassuring. I really can't bear being sick.
Of course. Chemotherapy, it can also affect your tummy, your bowels. Constipation and diarrhea, unfortunately, are common side effects of treatment. Diarrhea is more worrying for us as the clinical team looking after you because of the risk of dehydration. If you start to pass frequent loose, watery poo, we need to know about it. And again, you need to phone the acute oncology helpline. Don't wait until your next appointment to tell us. With some treatments, we prescribe anti-diarrhea medicines to take if you experience diarrhea, but your team will tell you if they're going to prescribe these for you. A bit like with the anti-sickness tablets I mentioned earlier. If we think you might be likely to get a certain side effect, we'll give you something in advance to counteract it. But if we're quite confident that you won't get a particular side effect, we won't automatically give you something to help stop it.
Got it. If I need to run for the loo, I need to remember to tell you.
Over time, repeated doses of chemotherapy can affect other things in your blood, such as the way your blood clots. That's something we monitor through the blood tests you have before we give you the next supply of chemotherapy tablets. We want to check that the part of the blood which makes sure it clots, the platelets, are within a certain range. We also want to make sure you're not anemic. Anemia really just means that a part of your blood called red blood cells are low, and this can make you feel very tired and sometimes short of breath.
That sounds a bit complicated. So do you mean the doctors and nurses will be checking other things in my blood?
You're right, Yugochi.
Yes. Okay. You know, my hair falling out is one of the first things I thought about when the doctor told me I would need chemotherapy. Could we talk about that now?
Yes, let's do that.
You see, I had this image of what cancer looks like in my mind, and that person I picture is always bald. Will my hair fall out?
The first thing a lot of people worry about is losing their hair, but it doesn't always happen. With oral chemotherapy, you may find your hair becomes thin with certain medications, but you're unlikely to lose it. But if you're particularly worried about thinning, be sure to ask one of the clinical team. Rest assured, Yugochi, whatever happens to your hair during chemotherapy, there's plenty of advice and support to help you cope with any changes. And don't worry, it will grow back when treatment stops.
Okay, that's definitely good to know.
It's important to know that your skin will be more sensitive to sunlight whilst you're on treatment. So it really is important that you wear sunscreen in the sunshine and do wear a hat. You may also notice that your skin becomes drier or discoloured. Some chemotherapy medications do cause rashes or other specific skin and nail changes, but your doctor or nurse will tell you what's most likely to happen to you. If your skin becomes inflamed, sore or cracked, you must call the 24-hour helpline for advice. Don't ignore it and just carry on taking the chemotherapy medicines. That's really important, because if you leave it, it's likely to get worse. You might think that sore skin can get better by itself, but this usually doesn't happen when you're taking oral chemotherapy medicines. For skincare, we recommend a mild unfragrance moisturiser to keep your skin hydrated, but above all, sunscreen.
Okay, wear sunscreen. Got it. Is it true that everything tastes of metal and cardboard when you have chemo?
Okay, let me tell you about that next.
It's just, I love my food and really enjoy my cooking. The kitchen is my happy place, and it relaxes me to cook for my friends and family.
I understand. You might find that your favourite foods don't taste the same anymore, and so you go off them or even lose your appetite. This is because chemotherapy can temporarily damage your taste buds. We can't unfortunately do much about the taste changes, but you could try experimenting with different flavours, herbs and spices to see if that helps. Your taste buds will return to normal when your treatment ends. The inside of your mouth may feel sensitive or sore or dry. You may get a few mouth ulcers. Now, if this does happen, you can use salt water to rinse your mouth a few times a day, and we can give you mouthwashes and other things to use. And it's a really good idea to use a soft toothbrush during treatment. It's a good idea to get any routine dental work completed before you start chemotherapy, if you can get an appointment with your dentist in time. But if you do need to see a dentist, then you must let them know that you're having chemotherapy. If your mouth is sore and it is affecting what you eat and drink, you should contact the 24-hour helpline and tell us. Please don't just wait and hope it'll get better by itself.
Do you recommend any special sort of diet?
No, we don't. A healthy, varied diet is good, but eating what you fancy and grazing is good too. It's important to eat regularly to keep your energy levels up. If you find it difficult to maintain your weight, your doctor or nurse may refer you to a dietitian for some advice.
What about herbal medicine? I take some herbal tinctures to help with my well-being. Are those okay?
It's really important that you tell your doctor or nurse about all medication you're taking before you start treatment, and that includes any herbal remedies or supplements, as not all medications are compatible.
And alcohol? Is it safe for me to have a glass of wine?
Yes, it is. A small glass of wine shouldn't be a problem, but you might find that alcohol has more of an effect on you when you're taking oral chemotherapy medications. Some people say it tastes different. Feeling tired or fatigue is a very common side effect of chemotherapy and can often increase over time.
Increase? Oh, that's a shame. I'm already tired when I get home from work.
Right. It can help to keep a record of how you feel on different days because you might notice a pattern and then you can plan around it. There's a lot of help and advice on coping with tiredness. Just ask us, won't you, if it becomes an issue for you? And do accept help from family and friends who are looking out for you.
And what about work? What do other people usually do?
It's a personal decision whether you choose to continue working during treatment. You can talk this through with your doctor or nurse and also ask your boss about flexible working, like going part-time or doing fewer shifts. That's pretty much all I wanted to say on side effects just for now, unless you had a question, Yugochi.
What do I do if I forget to take the chemotherapy tablets or capsules?
Yeah, good question. If you forget to take the chemotherapy medicine but remember within 1 to 2 hours from the scheduled time, you can go ahead and take them. But if you remember later than this, you should just wait until the next dose is due. Never take double the number of tablets or capsules to try and catch up. That's really important, as it may make the side effects much worse and could be a bit dangerous. If you think you might struggle with remembering whether you took your tablets, please let us know, and there are things we can do to help. We'd ask that you only handle the medication yourself and don't have others touching it. In any case, you should always wash your hands after touching oral chemotherapy. Also, as with other medication, please do keep them where children and pets can't reach them. If you have any spare tablets or capsules left over, for example because you missed a dose or we told you to have a break, then you should bring these back to the hospital with you and we'll dispose of them for you. It's really important that you don't save them up and mix them with the next supply of chemotherapy medications.
This might sound silly, Joe, but I'm not very good at swallowing big tablets or capsules. When I see one, I feel really scared that it'll get stuck in my throat. Can I crush or cut the tablets, or split open the capsules and take the powder out?
No, Yugochi, we wouldn't advise that. If you are worried about being able to swallow the chemotherapy medicines, do speak with your clinical team. You may be able to dissolve some medication in water, but only if your clinician or pharmacist specifically says that you can. I don't mean to scare you, Yugochi, but chemotherapy medications really aren't like other medications. They're quite serious, and so we're more strict about what you can and can't do. Do you have any other questions, Yugochi?
I don't think so. You've told me a lot today. Oh, actually, yes, I do. It's a bit personal, but can I ask about sex and intimacy? Is it okay to still have sex while on oral chemo medications?
Of course you can ask about sex. You can ask anything. It's fine to have intercourse, but you will need to use barrier contraception, like a condom. It's important not to get pregnant whilst you're on oral chemotherapy treatment. A condom will also protect your partner from being exposed to any of the chemotherapy drugs, while they could still be active in certain body fluids.
Okay. And is it okay to take a short break away? We already have a holiday planned, but can we still go?
Usually, yes, but just run this by your doctor or nurse. Anything else you'd like to ask?
Not at the moment, but I expect I'll think of things later. Thank you, Joe.
Oh, don't be afraid to ask your doctor or nurse any questions. No question is too small. We also have Macmillan information and support centres at most of our hospitals, and the staff there are good with hints and tips on coping with side effects at home. They've even made videos you can watch on the Royal Free website. The link to the webpage is in the description of this video below.
I will definitely pay them a visit, and if I get these side effects, I'll remember the videos.
I hope you got you starting to feel more confident. It's natural to be nervous before the first oral chemotherapy treatment, but nobody goes through this alone. There's a whole team of us right here to look after her during her treatment.
Well, I understand a lot more about tablet or capsule chemotherapy now, but I won't lie, it's still very daunting. Joe has talked about a lot of side effects today. I really hope I don't get many of them, or any of them, if that's not too much to ask. I suppose once I actually start treatment, it will make much more sense. For now, I'm off to grab my notebook and pen so I can write down some questions to ask next time. Perhaps you'd like to fetch your notebook and do the same. Or maybe it's just been a lot to take in and you'd like to go through all of this again. Feel free to rewind, rewatch, and repeat as many times as you like. You can also share the link with family and friends. I hope this information has reassured you and hope your treatment goes well.